obesity is extremely related to infertility. And when I say infertility, that infertility starts from first getting married, right? Now, obese people find it difficult to have a social partner, and I'm not saying that it's difficult to find, and you could be in love and you could find a good partner. However, in our subcontinent, obesity is a problem. Number one, finding a partner. Number two, having a physical relationship with a partner may be difficult, and it is usually seen in the last 3 decades of practice. Partners, so if one partner is obese, the likelihood of the other partner being obese is slightly more. So having a physical relationship between two obese partners becomes difficult. Third is infertility, because you have anovulatory cycles. That means you may be having regular periods, but your cycles are anovulatory. Third is because of the male partner. The male, if is slightly on the heavier side, will have some amount of oligospermia or azoospermia. That means the sperms could be of low quality or immotile or dead sperms. So both the partners will have suboptimal or subnormal fertility. And then conception, that means fertilization is a problem. And then the embryo, which gets attached to the lining of the uterus, that becomes difficult. So in all stages of reproduction, obesity plays a role. So if you are obese, or if you think that you're on that line of obesity, please take care of yourself, because in longer run it can cause infertility.
Thank you, doctor. The next question is, are there medications or supplements that could help regulate my periods?
Oh yes, and I would not want to comment too many things about regulation of the periods. I think that's the domain of a gynecologist. So if you are having a problem with your menstrual irregularities, and if you're obese, I think you must consult both your bariatric surgeon and your gynecologist, who can work up all your hormonal tests can be done. And if it is related to obesity, yes, certain drugs can be given to you. And if it is not related to obesity, then I think your gynecologist would be a better person to suggest drugs which can be given to regulate your menstrual cycles.
The next question is, how can I differentiate between normal period irregularities and signs of a more serious condition?
Again, I think if you take in terms of just menstrual period, a normal flow could be anything between 3 days to 7 days. A few ladies will be over with their flow in about 3 days, some may take about 7 days. So there is a normal variation. These normal variations can be in families because of genetic, because of your hormonal play. So anything between this is taken as normal. And again, the cycle can be anything between 21 days to about 35 days. That's again taken as normal. So different people or different ladies will have a different period cycle. And for this, again, I would advise that you should, and if you're not obese, and if you're still having menstrual irregularities, I believe you should see your gynecologist, and they should be the one who should be evaluating your menstrual irregularities, and they should be the one who should be treating you.
The next question is, are there any long-term risks like endometrial hyperplasia or infertility if my periods remain irregular?
So endometrial hyperplasia is when your lining of the uterus becomes more active and it has much thicker lining. So that's endometrial hyperplasia. That normally can happen because of hormonal imbalance. That is number one. It can also happen in PCOS. Now both these things, if related with obesity, then obesity is to be blamed. But if this is happening in spite of you being in a normal weight, then yes, it needs to be investigated. It needs probably an ultrasound should be done. Your hormonal test should be done. In a few cases, probably a DNC or an endometrial biopsy should be done to see why it is happening. And again, I would suggest that you meet your gynecologist, because they would be the one who would be deeply digging into the problem of hyperplasia and menstrual irregularities if it is not associated with obesity. If it is associated with obesity, yes, you must talk to your bariatric surgeon, your bariatric physician. They could do your hormonal assay along with the gynecologist and do a good plan for you.
Thank you, doctor. The last question is, how often should I follow up to monitor improvements in my menstrual health?
I think every month, because you have a monthly cycle, so each month is a good time to see how your menstrual health is. That means if you have been having excessive flow or scanty flow or mid-cycle spotting, or you've been having a lot of pain and cramps, then each month you can actually follow up to see how you are faring with either dietary modifications, certain drugs, and if you are on a path to do weight reduction. So you should follow actually each month. So it's not that every 3 months or 6 months you should do. Yes, in terms of getting you investigated for your ultrasound, probably 3 to 6 months is the right time. But then again, you should follow up closely with your gynecologist, because they should be the one who should be telling you how closely you should monitor yourself with ultrasound or with an internal examination.
Thank you, doctor, for your valuable insights. Any last concluding message that you would want to pass on to our audience?
Yeah, so dear ladies, as I said, as I started early, that obesity is a killer. Obesity is a disease, and it relates to your menstrual health in a very, very complex way. It not only can cause PCOS and insulin resistance, it can cause infertility, and it can cause menstrual irregularities. So if you think you are in a category of being overweight or obese, please talk to your surgeon, take care of your diet, see to it that you make a very practical diet, include certain exercises in your daily routine, so that you can slowly, gradually, consistently lose some weight. Because once you start losing weight, the good effect of losing weight will show not only on total health but also your reproductive.